Welcome back. So joining us on the show to discuss about Honey and Banana Connect, toll-free center by DKT Nigeria, is Honey and Banana call center nurse Oluoma Edim and nurse clinical and training specialist at DKT Sarah Odeniro. Welcome to the show.
Thank you.
And this Honey and Banana I just said, I'm sure many people will be confused. What are the, which one is Honey and Banana? What are they talking about? So please, let me start with you, Oluoma. Okay. What is Honey and Banana about? Because my mind went to several other places.
Exactly. Okay. Thank you for having us on the show.
You're welcome.
Honey and Banana, like it says, it's an initiative by DKT Nigeria International, a program of DKT International that's a leading contraceptive family planning that that gives women contraceptive advice and tell them how to take up what a method is appropriate for them to, that suits them at the point, affordable, and gives them options.
Amazing.
Oh, nice.
Yeah.
Okay, so when I heard of Honey and Banana, I said, let me ask you, how did that name come about? Why the name? You understand? And then who can use Honey and Banana?
Okay, it's youth friendly. It's because of we want people of reproductive age to be able to how will I put it, how will I put the word to be able to embrace the name. Contraceptive is not something people just want to talk about, especially when amongst young adults. So that's why that name Honey and Banana came, because it's quite interesting. When a young person hears Honey and Banana, just like how you are intrigued about the name, it intrigues them and you want to know more, you want to hear more about it, and with that we can catch you and tell you what it is and how you can begin to take charge of your life as a young person.
All right, so I think I want to hear from Oluoma. Let's talk about the impact of family planning and why it's very important, and what Honey and Banana is doing to actually promote family planning amongst Nigerian families.
Okay, Sarah, right?
That's Sarah.
Sarah. Okay, sorry.
So as Oluoma has rightly said, we want to create a very ease and peaceful environment that people can come out to express themselves. At first, when you hear the word Honey and Banana, you'll be curious to want to dive into it, to ask the question, what is the banana all about and what is the honey? Is a catchy word, whereby we need people to come out and express themselves and actually take up a method and debunk the myth or misconception on contraceptive use. A platform where everyone has a voice to learn more about it. We are trying to remove the fear, the anxiety, whereby a woman will be stigmatized whenever she talks about family planning, whenever she wants to take up a method of contraception. So she knows that there's an opportunity and avenue where she can ask more questions, where she'll get a lot of answers from our, of course, educated nurses who knows about the methods and the services and the provisions, you understand, in our social world. So they need to really have this information, a place where they are free. So that's what Honey and Banana is all about.
Okay, I'd like to know, because if I'm going to, in my layman explanation, honey is we. The bananas are the men.
Thank you, you got it. That is just it.
Oh my God, we already know what it is. But now, if there's a lot of face or eyes on the honey. You see these bananas, they keep wandering up and down. So what are you doing? What are your measures in helping the bananas help themselves? That instead of you to leave honey 1, honey 2, honey 3, you are just going and be doing a fruit up and down, you're planting seed. How can they also plug in without necessarily seeing it that, you want to clamp them? Because the average Nigerian man feels that the moment you're asking him to come and do family planning or vasectomy, you want to clamp them.
It's a woman's world.
Yeah.
So actually, it's a shared responsibility.
Yes, it is.
Because in a relationship, I would term them partners now, not couples. So for a partner now who wants to take up a method, you need to support your spouse. We see some men coming out to even say, don't worry, I'll go for the options available for men. While you just, 9 months is a journey on its own, where you have that child and you're still spacing, you have other things to do. Let me carry the burden for you. So it's a shared responsibility, and we encourage spouse to have an open discussion about it in the community, in the family, you know, everywhere. We even advocate for men now to talk about it. To talk about it. So we need them to tell their other counterparts on the importance of you taking the burden off the women. You know, it's about the honey, yes. So let the banana to have a role to play in the aspect of contraceptive uptake in the country. Even in the northern side, we have people coming out to, to talk about it, even in churches, in the mosque, to people to say, oh, encourage your wife. Because when we see women come out for contraceptive uptake, they will ask us, let me talk to my spouse. Let me talk to my partner. Let me take his permission. And those women, most of them have underlying health challenges that are, deter to their health. So we need the spouse to step in that regard. So the advocacy is actually on for them to actually have a shared responsibility as well.
Let me come to you, Oloma. So I remember, we're talking about it. Last week, Saturday, we talked about a woman who had given birth to 5 children, and then she was spotted again pregnant for the 6th one. And we opened our phone lines to people calling. And one of the callers actually mentioned that the husband has refused any form of contraceptives. He doesn't even wear rubber, not at all. And there's nothing she could do about it. Now, I'd like you to highlight the importance of family planning and how you think women can begin to take control of their body with or without maybe consent.
Of their
because that consent was very heavy.
Yes,
No,
yes.
he does not. So there's nothing I can do. I've had 3. I'm on the 4th one now. And he says no.
So I would say a lot of women are not enlightened enough to know what it does to them as a woman giving birth like every year. So they need to understand that their life is on the line.
Exactly.
And they need to also know that they can't achieve a lot. Usually if you have a child, just imagine, it takes like 3 or 4 years before that child begins. You can actually just say, okay, this child can now be on his own. You have to be. So 3 years or 4 years of your life is attached to that child. You can't do any other thing. So when we begin to make them know the economical impact on you as a person, your health, like you can lose your life. You can lose your life. Maternal cases. So you can lose your life. When they begin to understand it, so we are working on enlightening women more to know this by themselves. So we are not saying you should disobey your husband or not, but there's a way, that methods that you can take that your husband may not know that you are on a method.
May not know.
Wisdom.
So what I'm going to say is this: a lot of women are the ones, because in this part of the world they always believe that it's the woman that should take something responsibility to stop the whole thing and everything. So now for the men, if you are saying the men should start taking contraceptives, what are the side effects for their own?
For men.
And let them know, at least, so that
they never even start. You don't go to side effects.
Let them know the side effects so that they will.
No, presently the only method we have now is the use of barrier methods. And the other surgical aspect of it. Yes, of course, innovation is still ongoing to know the other options they can actually explore from. But not that we are really pushing them to have it done. Is an informed choice and decision, whereby, as I said, via discussion together, you know what works best
for you.
There are women that will come out to say, I want to be the one to take up the responsibility of contraception in the family, in the home, or for my spouse, or for my partner. You understand? So you don't force them, just let them know the advantages about it. And women, we are so caring, and we're like, oh, let me just bear it all and everything.
Emotional
damage. You understand? And you're crossing more arm to yourself. There are other options. Let someone carry the weight for you, if
a little at least.
And discussion. We realize that most couples don't discuss among themselves. The woman will just take the decision on her own. Even the man will ask, when are you going into it? How did you come about it? You understand? It should be a discussion between the two of them. And when the man sees the reason, you'll be willing to assist. So with the ignorance, that's why we DKT Another Banana, we are all out to create that awareness. For the couple.
We talked about consent just now.
Sarah.
We talked about consent.
We have some funny men. Yes. Because of ignorance and ego.
Yes.
Wouldn't want their wives to go into it. And they will say, once you take the method, she becomes promiscuous.
Yeah, that's
You heard about
yes,
that?
yes,
Mindset.
yes.
I won't be the only man
Mindset.
in her life anymore. So she has the control.
Can you imagine?
Wow.
That
So the myth is
pregnancy that is stopping people from being
promiscuous.
Yes, sure.
pregnancy on that level. Some people would tell you, oh, my grandma had 15 children.
Yeah.
Me too. I want to have like 10.
Yeah, they want to break the record.
This mentality.
Oh, yes, there's a lot of mentality.
Exactly. A lot of, those are the main concern with men regarding it, that you see them objecting to their wife taking up the method. And when they get pregnant, they'll be the first to cast the stone. Don't you know what your mates are doing?
You are pregnant again.
You are pregnant again.
Can't you
Are
take
you
care
not
of yourself?
supposed to, take care? They won't say, I forced her into
They won't say, I did
We see a lot of women come out, to either and say, please, we need this method. They call her on it. They call her call center.
Anonymously?
Yes,
Yes, they will just call you.
They will
So
say, please, I need the method. I don't want my husband to know.
Okay.
So how does
Please
someone
say it
get involved with Honey and Banana? Is it like a community? Is it like a hospital? How does it work exactly?
Okay, it's a 7790. You call the call center. It's a call center. You can call in.
Toll-free line.
It's a toll-free line.
Oh,
You
nice.
call in, and we have counselors on ground to counsel you on your journey, telling you different options on the method that best suits you. And we have partner clinics that we refer you to.
Okay.
Yes, we refer you to our own partner clinics
Accredited
that have been
clinics.
trained to carry out the service for family planning. Because not every hospital has trained providers.
So is there any tests that will be conducted first to determine which one would work for you? Because I shared my story on Saturday where I did one injection and it gave me ovarian cyst, and it took the blood of Jesus to get that thing out.
Sorry, now BC, let me relay. You said you gave you ovarian. You see, this is where the myth and misconception comes in.
Okay.
What is ovarian cyst? They are underlying condition that can predispose a woman to ovarian cyst, even other health challenges, not the contraceptive. Is in this part
I
of
had
the
to
world.
link it to
Is in this
because
part
it was
of the
only
world.
when I did it.
Is in this part of the world that you see that you did contraceptive, you attribute it to malaria, you attribute it to typhoid and everything. You understand?
But why did it come at that time?
A particular woman was actually losing weight, and she was attributing it to something else. You understand? So everybody wants to attribute it to something that the world will know and put eye. But some of them might be battling other conditions. You understand? So for contraceptives now, yes, it's 99.9% safe.
Okay.
I can tell you categorically.
No adverse effects?
Modern methods of
Methods of
contraceptives.
contraceptive.
Yes. Of course, they will come with their slight effect, which varies from different women.
Okay.
When we take a particular method, the way you react will be different from the way I and yourself will react to it. So whatever thing you come up with, it's good and key to talk to your health provider, whatever it is. And the challenges will, be managed immediately.
Can they
So
manage
she
it?
asked the kind
Sarah,
of test.
you
The
cannot
kind of test.
convince me on this one.
Honestly.
Starting with the type of test to be done,
Yes.
of course. I want to know your body weight.
Okay.
I want to know your blood pressure.
Okay.
I want your reproductive history,
Okay.
your medical history.
Okay.
If you've told me you've had probably some symptoms, abdominal pain, hirsutism, all this condition, I will need to know the method to give to you.
Okay.
We have
So
the
that
barrier
testing is
methods,
very-
we have the
Yes.
hormonal methods,
Okay.
and we have the
Non-hormonal.
non-hormonal, which are the IUDs, that we give women that have any hormonal challenges from effective counseling. The provider would know the
What
method
method
to
to
give
give
you.
you.
Thank
Okay,
you
so
so
are you
much,
saying-
Sarah. We are going. Thank you.
When it comes to family planning, we women were
yes,
ready.
we
We
are
were
ready.
But we have to go. No, we don't have
We
time.
have
The
to.
producers are on my ear. We have to go. Thank you so much for coming. If I leave you,
I have a lot of questions.
I have a lot of questions, but
Yes.
you have your
Call the
call.
toll line.
Yes,
toll
yes,
line.
call.
7790, yes.
Any
On any
network
language,
provider.
yes.
Any
Any
language.
language. We speak
language.
Igbo,
Yes.
Yoruba,
Okay. We have a social media.
Hausa,
Okay.
English,
Oh,
Pidgin.
nice.
You can
Social
speak
media
any
handle,
language
Luca.
that
Thank
Social
you
media
so
Yes,
much.
Honey and Banana.
On Instagram,
On
Facebook.
Honey and Banana.
Yes, Honey and
Thank you
Banana.
so much, Sarah and Oloma.
Thank
from
you for
Honey
having us.
and
Thank you for
Banana.
having us.
If you people want more information, just call the toll line and get all the information that you need. That's all we can take on this segment. When we come back, we move into the hot topic for today. Stay with us.
Stay tuned. Your View will be right back.